Peds Patrol here, and my last video was on a quick refresher on asthma. I wanted to spend some extra few minutes talking about asthma medication and how to use them properly, just so you guys out there who have asthma, especially with your kids, or try to troubleshoot these tips at home before you head to the hospital or talk to your family doctor. So your blue puffer, which is your Ventolin puffer, that's the puffer that you use to open up your airways when you have coughing, shortness of breath, wheezing, or respiratory distress. This is the one that's an immediate reliever medication. So this is the one that you need to have on with you at all times, especially if your child is running or going outside, going to school, and playing different sports. This is the one that you really, really need, especially in emergency situations. Common side effects of this medication can include palpitations or nausea because it does make your heart rate faster. And so some of the things that kids might say is that, "Mommy, Daddy, I don't feel so good." That's probably because of the Ventolin, but this does subside. You just need to maybe sit them on the bench, sit them at home, a little bit of rest, and the feeling will go away. How much of this you need to take, you should talk to your family doctor or pediatrician, or if you have a respirologist or an allergist, they will tell you how much you need. It is weight-based and age-based, so definitely check with them to make sure that you're getting the right dose when you need it. The other medication that you'll see is an orange puffer or like a dark yellow puffer. This is usually an inhaled corticosteroid. This one in particular is fluticasone. This is a medication that you take on a day-to-day basis, usually once or twice a day. This is an inhaled corticosteroid that's supposed to reduce the inflammation of your lungs. It helps relieve inflammation as well as reduce the risk of exacerbations because you have your asthma under control. Otherwise, a controller medication. The most important thing to realize about this medication is that it does have some side effects, just like the Ventolin, most commonly oral thrush, which is plaque-like features that happen on the tongue with chronic usage. The most important thing is remembering to rinse your mouth after you use this medication to reduce the risk of thrush. Another side effect you may hear about is potentially shortening of your adult height because you're on steroids and potentially for chronic uh, length of time. However, really the studies aren't there as much as we think they are. And if there is, maybe about half a centimeter of total height reduction if you're using this for a long period of time. I'll get a lot of families asking, I don't want my kids to be on steroids. It's not safe for them. What they're really thinking about is oral corticosteroids, which is what we give to patients in hospitals when they have significant asthma exacerbations. Those are 1,000-fold concentration difference between this, which is in micrograms. So definitely this has a better safety profile than oral medication of steroids, which can cause changes in behavior, aggressiveness, and high blood pressure and high sugar as well. One of the comments that I'll get is that sometimes the asthma medications don't work because they put this in the child's mouth and they still come into the hospital with an asthma exacerbation. Most important thing not to forget when you fill your prescriptions is to get an aero chamber. This is effective asthma treatment management in children and teenagers as well, and some adults. They come in different sizes depending on the age of the child and the face mask, as well as for older children as well. I'll post some links from About Sick Kids in University of Toronto in terms of how to follow instructions on how to use these air chambers, but this is really, really key in terms of how to get the aerosolized treatment into your child's mouth. First and foremost, you want to check and make sure that these aren't expired and that it's actually some puffs that are left. And don't worry, they have more puffs than needed in each canister, so you're definitely not going to be wasting them, even if you have a few that you need to push out just to see if it works. Shake it and then puff, there you go. You then want to actually insert it into the end of the tube and then keep shaking it like this as well. And then have this face mask on the child's face after they take a deep breath in and then out. Then what you want to do is actually press the depressor in, and then the child will breathe up to 10 seconds to make sure that effective nebulization is going through and they're getting all that good stuff in their mouth. One of the good ways to check if your child's actually breathing is there's a little valve right here. This has to go back and forth to ensure that the child is actually taking in a deep breath and exhaling as well. And you just don't do multiple puffs at the same time. You actually have to repeat the process all over again. So which includes shaking and then one more puff if this is the orange puffer. With the blue puffer, you may have to do this 2, 4, 8, or even 10 times. So basically shaking each time, making sure the child is getting in the puffer one puff every 10 seconds. So if you're not doing that at home, you may actually not be doing proper technique for asthma management at home. The other thing to do is talk to your family doctor or pediatrician or respirologist is an asthma action plan. So it's hard to see here, but you'll have a green zone, yellow zone, and red zone. And these are really important because it tells you about symptom control, but it also tells you about what medication to take and when to take it. This is very, very key. You want to review it with your family doctor or professional at all times at every single appointment because kids grow, kids change, and their needs may change. They may outgrow some of their asthma symptoms as well. So it's always something that's a movement in process. Anyways, hope this helps. Let me know if you like longer content as well. I find more space and capacity to do more education around these videos. So if you definitely like this type of style, let me know and I'll post more. Thanks.